Hi everybody, so it's just 11:30, so we might get started. I hope you all had a nice comfort break and enjoyed your cup of tea, your exercise, or maybe checked out our website. We are going to welcome our next speaker in just a moment. So we know that dealing with the diagnosis of MS can be a very difficult thing, and you're certainly not alone in feeling that if you're finding it tough. It's a lot to process. And our next speaker is Mark Mulrooney. He is a clinical neuropsychologist at Beaumont Hospital in Dublin, and over many years he's contributed generously to the understanding of the psychology of living with MS, and that's been incredibly beneficial to people living with MS, their families, to healthcare professionals, and to MS Ireland as an organisation. So we're absolutely thrilled to have Mark Mulrooney join us this morning to talk to you about coping with a new diagnosis. Mark, we might just hand over to you now, and we'll take any questions again at the end of the presentation. But you can send them through, throughout the presentation, you can send them through the Q&A function or through the chat. Thanks.
Okay, so you can hear me, yeah?
We can indeed, yeah, and we can see your presentation.
Perfect. Okay.
Thanks, Mark.
So listen, thank you very much for inviting me to speak to you today, and it's great to see so many people online. If you, like me, are discovering new places to use in your house, I'm currently in my attic here. But it's certainly a new way of interacting with each other. But look, we have to make do with what we can. So again, thank you very much for inviting me to talk to you. And I had spoken briefly with Sean about the topic today, and he asked me to talk to you about, with a kind of a emphasis on coping with a new diagnosis. So again, that's kind of going to be where I'm at today, the idea of having something given to you that possibly you didn't want, and what do we use to cope with things like that. So as Aoife mentioned, I'm a clinical neuropsychologist. I work in Beaumont Hospital, and there is a possibility I might have met some of you, maybe not, but I do meet patients with MS. They're part of the group of people that I meet. I also meet other patients with various other neurological conditions, for example, Parkinson's disease, epilepsy, progressive aphasias, ALS, Huntington's disease, you name the condition. Because Beaumont Hospital is the national centre, we tend to see a lot of different and varied neurological conditions. I suppose I'm also aware of other chronic conditions just by virtue of what I do as a psychologist. And I suppose each condition is different. There's no question about it. But I suppose the one thing that each of these conditions do is it puts limitations on us, or it certainly changes the way that we see or view ourselves, or it changes what we understand who we are over the last number of years was. And our doctor then says to us, well, this is what's happened now. And then you look at life almost through a different lens. So I suppose that's what we're going to talk about this morning. What are the kind of things we can do with an emphasis on coping? Okay. Now, I don't know whether any of you has seen I have a little screen when I turn off my camera. I have a little orange, and basically the orange is carrying his own skin, and it says sometimes in life you got to carry your own stuff. And I suppose that's kind of my mantra for you, that most of the time you do end up having to carry your own stuff. And I suppose we're all equipped differently as to how we do that. Then, if that's difficult, we then look to others to support us, or what other supports are available to us. So let's have a look at this and see how we get on. I'm going to talk until about, it's now 25 to 12. I'm going to talk about 12:15. And then I'm going to stop, and I'm going to offer 15 minutes then for people if they have questions. Trust me, I can talk for a lot longer if you like, but I'm going to set myself the target of talking for 45 minutes. If I end early, we can do more questions. And I'm very happy if you send the questions through, and let our, there's kind of a chairperson there kind of looking at the questions, and it's easier then you can spot themes of questions and we can take them all together. Okay. So let me just advance on here. First of all, for somebody with this condition, you have a confirmed diagnosis of MS by an appropriate consultant. So that's the first thing. And I suppose you've met and you're satisfied that, yeah, what my doctor has told me is a fact. I And I suppose there's a little box to the side of that screen which says the journey to your diagnosis. And I've met many people, some of whom are disappointed, upset, angry, whatever words you want to use, about maybe they went to their GP 4 years ago, they were complaining of symptoms, they may have been more vague than they are now, or, but certainly there is a journey to get to a point where you meet somebody who is in a position to say to you, I've checked your neurological status, I've checked your scans, and we have certainty that your diagnosis is this condition. And I suppose there is a sense of, I've been dealing with this for a number of years, and it depends on the prodrome of your condition, how long that might be. So now, at long last, you have somebody who offers you certainty, which on the one hand is good, because now somebody has explained, why am I feeling like this? Why do I have these symptoms? But then on the other hand, you now have confirmation of a process that may not make you feel too good. But the first thing is that we have a confirmed diagnosis. Okay. The next thing we have is, okay, I've looked at this title, I've looked at what my doctor has said to me, I've looked at myself, I've looked around, and I'm saying, like, what does this mean? What does this mean for me? One of the things that I would say to you about multiple sclerosis, or MS as we call it, is that it's hugely varied. And I'd love to be able to give you a roadmap as to how this condition, listen, the first step around the corner is this, then the next corner is that. But unfortunately, there isn't really a roadmap for you. What we do know is that this disease is very varied, and one size doesn't fit all, although there are some things that we know about how the condition can affect you. The other thing I was going to say to you is, and it's the second piece I have here, when people say, look, you've just got to accept it. That's very easy to say. It's often quite difficult to do. And it depends really on your own, who you are, what your style is. I consider myself to be a very pragmatic person. I look at things, I look at the best thing I can do, and I do that, and that tends to be my style. For most things, it suits me fine, and it gets me out of most of the scrapes that life brings me. But I know there are certain things that it's not a good strategy to have, my style of problem solving. Likewise, your problem solving style might be different. Somebody throws you a curveball. Sometimes your style fits it and you're able to move along. Other times your style doesn't fit. So one of the things I would say to you is have a look at yourself and say, okay, this old age-old expression of the glass on the table, is it half full or empty? What's your style? Are you somebody who's normally pessimistic? Are you somebody who then catastrophizes about what this means for me? I'll never see my children. I'll never, whatever. Or are you somebody who goes, look what I have, look what I can do. And these are kind of styles that we have in coping. And I suppose the question is, right, for some of us, those styles are good and adaptive. For other times, the styles aren't good and they're maladaptive. And it's a key word for me. I like that way. Rather than good or bad, think about your skills as being adaptive. Adaptive means you're able to change. You can do things. You can use a situation. Whereas maladaptive, there are habits that don't allow you to form or move around a situation. So the first thing, I suppose, is we talk about acceptance. And just in case you think I'm trying to suggest to you that this is easy to do, I'm not for 1 minute, but I suppose my job is to try and help you. And that's what I'm trying to do. So when life throws you something that's nasty, bad, tough, horrible, I suppose one of the things we talk about is acknowledging this. And it's almost saying, okay, I have this. This is with me now. This is going to be with me. It's going to be with me for as long as I'm around. Some people try to say, no, I'm just going to pretend it's not here. I'm just going to live. I'm going to go, and I'm going to, like, if a symptom hits me, fine, but I'm not changing what I do. And I suppose there's merits in both ways, but I suppose from my point of view, there's a sense of acknowledging a situation and then saying, okay, how do I currently feel about this? How is the process currently manifesting in me? What do I need to do about that? And it's funny how things happen. I met a lady the other day, and I won't be breaching confidentiality or anything, but she had a lifelong neurological condition. And she was a very successful lady, a very bright lady. She had reached very senior levels. She was working at a very high level. She herself was very proud of her intelligence. She was proud of her smarts, as she should be, by the way. And she was delivering within a company at a very high level. And I met her, and she was talking to me about the difficulty she was having coping with her memory, coping with her condition, how it was affecting her, that she was getting caught short, that she now wasn't sleeping, that she was now stressing about how this was going to, that people would now know what was wrong with her, that they would see her as being not capable, blah, blah, blah. And I had to stop her and say, can I just ask you for a minute, do you have this condition? And she said, oh, yes, I have it. Yeah, okay. I said, I don't see in any way where you acknowledge this condition in how you're living your life. And for her acknowledgement of this condition was to say, yeah, I have it, but it doesn't impact me at all. And yet she would sit and talk to me about all the ways that the condition was affecting her. But she was nearly negating them and saying, I can do everything I do in my life at the same level, same pace, and achieve the same results, and no problem. And I suppose my image was that we talk about a candle burning at both ends. I reckon this lady had about 6 wicks on her candle. She was burning it so much. And looking at her, she was frazzled. So we had a long chat about what she was doing. And we kind of, I suppose in our business, we talk about a come to Jesus talk. That you need to sit down and say, okay, what exactly are you doing right now? What do you want to do? What's important to you? This lady also, by the way, had 3 children, or the ordinary stuff that goes on with life associated with those. She had a relationship with a partner. She had all the other things that you'd associate with life, and a job that was hugely demanding. But her acceptance of the condition was, I'm just going to do what I always did. And I suppose there is dangers and merits to doing that. I could see tremendous merits in what she was trying to do, but I could also see her burning out very quickly. I suppose the next thing we talk about is, developing a plan. Okay, let me sit down here and think about, what am I doing? What do I do? Who do I do it with? What have I got? How am I right now? What will happen in the next 3 months, the next 6 months, the next year, the next 2 years? How will I be? What should I need to do? How should I do it? Who will be there to help me? Who can support me? That's just a basic plan. And I suppose I always think of my dad, Sin's department dad. He used to talk about a piece of paper. He's a great man for getting a piece of paper and dividing a line down the middle. And he'd say, okay, make your plan and look at what's good and what's bad about your plan. Once you capture things on paper, it's very sobering. I'm a great believer, and it's very cheap. It doesn't cost much. It's a single piece of paper. You can use it on a pencil. That's it. Here's the next one. One of the hardest things to do is seeking help, asking for help. And again, I'm not talking about, asking people to carry what you're carrying, but a sense of, look, going to do what I'm going to do with this condition, not knowing how it's going to affect me, I may need to ask people to help me. Who are those people? How can I use what they have? Because, most of the people I live with, most of the people I work with, most of the people I share my life with, from the time I get up in the morning to the time I come back, they constitute the circle of people I spend my life with. I know there are certain people there that will help me. They're very happy to help me. And if I tell them that I need help, they will actually help me. But it's often very difficult to ask for it, because it's almost like I'm acknowledging a deficit if I have to ask for this. But I suppose that's part and parcel of how we go about processing what exactly is happening to us. I suppose the next thing, and this is going back to my friend I met the other day, is the idea of, what can you change? What can I change that would make a difference for me? Are there ways that I can tweak what I can do, or tweak what I'm doing, so that it allows me to keep going for longer? One of the changes I've made this year is I've decided to work 4 days a week. I had to sit down and I looked at the finances, and I said, okay, if I drop down a day, I actually go into a different tax bracket, which means I don't actually lose that amount of money. So dropping down a day has meant that I actually have a day where I'm not as frenetic as other days, and I use that day for doing other things. And look, as you can see, I'm at a different stage in my life when many of the issues associated with having young children are well beyond me, but I'm just saying to you that you can adapt and change, or change how you go about what you do. But you can change a situation and change all the things around you if you have the wherewithal to try. Just in case you don't need to write these down, I'm going to make these slides available to Aoife, and you can get them. I'm very happy for you to have them. Identify what you can't change. I suppose recognizing what you can change is very good, but then recognizing also, look, I have to go to work. I got to make a living. That's my priority. I've got to keep the show on the road. I got to keep my kids going. I got to keep my kid. Whatever your have-tos are, they are by their nature have-tos. Having them down on your piece of paper, they're very important. And they kind of allow you then to say, okay, well, what are the things I can change? But it also allows you to look at priorities. Okay? Recognizing the things you can't change also allows you to make the priorities about things that need to be kept going. And when we think about our resources, okay, so the amount of resources I need has to be devoted to that area, because they're the things that are very important. Now, this is an area that I'm often targeted on because I'm not a high on a feeling kind of guy, but I do have feelings from time to time, as most of you know. And I suppose developing coping skills to deal with them, because sometimes there's a sense of, when you get one of these pieces of information, I'm sorry, your diagnosis is of MS, your diagnosis is of this. When you get that information, there's a tremendous sense of unfairness. But dealing with sadness, anger, frustration, disappointment, whatever the feelings are you have, and I won't for 1 minute begin to tell you what way you should feel or how you are feeling. That's totally for you. But I think there is a piece of me that would be very sad about things like this, that I would be very angry. I would be all of those things and possibly more. And then there's a part of me that says, okay, how do I deal with this? Because this is not going to allow me to do the things I need to do. And it's about harnessing that energy, because again, feelings are essentially energy. They're within us. They give us great energy to do things, or they sap energy in holding us in a particular spot. Now, this is a difficult one, and I'm reminded about a guy who I got introduced to about 30 years ago. And he was talking about the characteristics of a staff member who works with people who need help. He was particularly talking about people. I worked in a previous incarnation in services for people with intellectual disability, and I was doing a lot of staff training at the time. And one of these guys, he talked about the characteristics he wanted in the staff that work with people with intellectual disability, and especially people with intellectual disability who challenge the system, who have what they call challenging behavior. And he talked about this idea that he had a whole lot of characteristics, but one of his characteristics was that the staff member had to have a characteristic of looking for the pony. Okay, now I know you're saying, what the hell is he talking about? And I suppose what he talked about an experiment that had been done years ago, when they would bring a child into a room, and in the middle of the room was a whole pile of horse manure, horse shit for you or me. And some people would come in and hold their nose and say, oh my God, that's disgusting. Other people would come in and say, there's got to be a horse around here somewhere. And it's almost like, okay, what is it? What are those positive things that you can do to harness a situation that is essentially bad? Where is the pony in this? Is there one? Can I find it? That comes back to possibly your orientation about how you go about looking at things in life. And again, maybe, that's not what I do. Maybe I do things differently. But if you have this gift, look for it and see if you can find, what are the things I can do to make the best of this? Okay. Now, we have a famous Irish philosopher, some of you don't know about her. Her name is Linda Martin, and in her famous song she wrote about why me. And I suppose this is another central feature to getting any illness. And it really doesn't matter what the illness is, I assure you. whether you've got type 1 or type 2 diabetes, chronic arthritis, fibromyalgia, you name the condition. You talk to the person and you go, I don't know why I got this. Why me? Why not someone else? And I suppose we go back to the old mantras of just anger and frustration, of the struggle to come to terms with the diagnosis. Why did I get this? Why me? Trying to understand if I've done something to deserve this. I suppose that's a particular way of thinking. And I suppose on a Saturday morning at 10 to 12, you can honestly say to yourself, look, I'm probably no worse or better than anyone else. There doesn't appear to be anything in my life other than maybe somebody I know had this condition, or maybe my mother had osteoarthritis, that's why I got it for free, or there's a familial condition. I'm personally waiting on diabetes. It runs through my family like woodworm and wooden legs, but it hasn't happened yet. The next thing we talk about is kind of grieving. There's a sense of the loss of your health and your old life. You know, what is going to become of me? I have a certain sense of who I am. I have a certain picture of the way I carry myself, the way I look, the way I conduct myself. I'm a competent human being. I have a sense now that I'm going to be less than that. Now remember, the condition MS, as I said to you, is hugely varied and it visits people very differently. And the one thing I can say to you is there really isn't a roadmap for you. And I suppose in some respects that can be frightening, because it's almost like I don't know how it's going to impact me. And I managed to hear just a few moments of your previous speaker, and I came in and she was talking about incontinence, and I'm saying to myself, oh my God, I don't want that. You know, and it's almost like a terrible tiny little detail of a condition that all of a sudden affects us in the most kind of intimate way in how we do things privately or public. And it's just a small little detail of how a condition could come at you. Facing up to your own mortality. What does this mean for me? All of a sudden, we're now at an age where I maybe didn't think I'd be thinking about this. I'm now looking around at people that are with me, excuse me, and looking at how this condition and what it will mean for them. The other one is the old ostrich in the ground. I'm just going to pretend it's not here. I'm going to act as if nothing has happened and either not so much deny the diagnosis, but really just go at it until it's manifest. Again, I have to say to you, in my head, I think I'd be like that. I have to say that to you. That's my own. I'd probably own that one. But I would then kind of counter myself and say, okay, it depends on what that means. And I suppose we're going to talk about maybe one of the features of this condition later on and why that particular style may not be a great one. Okay? Here's another little beautiful one. Regret or guilt about things that you've done and may have contributed to your illness in some way, that you think, you know, if I hadn't have done this, that made me more likely to get this. I don't really think there's any percentage in going that. Again, being pragmatic about how things are. Look, I have this. This is how it's going to be. But it depends on your style. A sense of isolation, feelings of being cut off. And again, you know, in my work, I get to meet a lot of people who come with this diagnosis. I met a gentleman there recently who talked to me about, he noticed that when he spoke to his friends to tell them about his diagnosis, he had a sense that there was a change in how they looked at him. I don't know whether that was real or apparent, but for him, it seemed to almost change the dynamic. And we talked about it for a while, and I asked him what it was he thought it might be. And I said to him, look, if you don't mind, look, let me just try something with you. I'm going to be you, and you're going to be my friend, and I'm going to tell you that I have this condition and see how you are. And we kind of worked it out that possibly what your friends are working on is, how do I talk to you about this? What do you want from me? Not as in, Jesus Christ, you're going to ask me to do things, but no, how can I be with you? How can I help you? Because this is going to be different. One of the things he talked about was his condition was going to stop him possibly playing football. So that meant his five-a-side game was going to go, and that was where he would meet his mates and they'd have a banter and have a bit of crack. And he said years ago they'd go for a pint, but they don't do that anymore, but they still get together. And he said this condition was going to stop him doing that and he would lose that. And he said, we talked about that. I said, okay, well, that's one thing you can't change, but what could you change about that? He said, well, maybe I could find other ways to link with them. I said, okay, what about that? So again, in a very kind of creative way, he said, okay, I have to look at what things are going to change. What are the things I won't be able to do? But then also say, right, if this and if that person is important to me, I need to tell them that. And I need to say to them that I want you to be part of this and I want you to help me through this. And this is what I want from you. I have to say to you, for me, I really like that. If somebody says, look, this is what I need from you, I'm happy with that. But often that's a very difficult thing to do. But I have to say to you, for me, and particularly for men, and I guess spoke about anything I can speak about this morning, men are very kind of, how would I say, they're very concrete individuals. They like being told things. And if you think that by some intuition, I'm going to find out what you want, or I may hit on it by accident, but I am better if you tell me. And it doesn't mean anything other than you've told me. And now that I know, I can do that. So I would urge you, so if you are somebody in a relationship with somebody, tell them what you need. Tell them what you like. It's very helpful. So I've said this before and I'll say it to you again. You're going to be sick of this, but MS symptoms are unpredictable and variable. And that's just how it is. One day you feel great. The next day you wake up and you've got a symptom cluster and you're hoping that you can get to hospital and get it treated, and that's what I can get back. One of the things we talk about is you don't delay that. If you have a symptom, you go to your GP or you go to a neurologist or you get in contact with your health professional, whoever that is that supports you in your condition. The longer you delay, the more likely it is that you won't get back what you had. Track your symptoms. It's really good. Now, I'm not talking about micro tracking where you record every small little wrinkle on your skin, but I'm talking about things that are going to be really relevant. So therefore, when you go to see your doctor, you say, look, this wasn't a feature of my condition last week, but I've noticed this is what's happening. I'm having this, I'm having more dizzy spells, I'm having whatever the issues are. There are plenty of apps available, plenty of them. And I personally don't know one right now, but I guarantee you there is an MS Society app, or somewhere across the world there's been an app developed to track your MS symptoms. Have it on your phone, track your symptoms. This sounds almost trite and simple to say this, but avoid MS symptom triggers. So things that you know that might cause triggers to be exacerbated. So let's look at some of the hotspots as what that might be. And I suppose one of the things that I would notice, and I happened to speak recently, and it was purely by accident, by the way. I happened to be speaking to a patient who was referred to me for some other issue, but they mentioned to me that they shared their life with somebody with the condition MS. And their biggest problem was looking at their partner doing things that they knew within a day or two would just kill them. And they were aware of it. They had spoken to their partner and said, do you know when you do this, and it looks great when you're doing it, but after you've done it for 2 days, you're gone to me. And that insight, although it's there, was an ongoing irritant within their relationship. So we have things that we know can exacerbate, can inflame. And I suppose your job is to do the things that allow you to maximize your wellness. And when I say wellness, I mean that in the most holistic aspect of what we're talking about. That includes your mental health, your spiritual health, if you happen to have one, your physical health, your emotional health. So that whole thing that makes you who you are. And if you share your life with somebody, if they have insights for you, listen to them, so that they're often useful in telling you what they've observed in you. Find the right doctor for you. Now, the best way I can explain this to you is that, look, I have people that come to me and they meet me and go, I can't talk to that guy. He's just not, I just can't talk to him. For that, again, other people come into me and says, man, you're the guy I've been waiting to meet. And I would say to people, look, when you come in and meet somebody, whether it's your neurologist, your GP, your counselor, whatever it is, if you don't like them, it's not a reason to not go to them. Ask them to refer you to someone else. Tell them you just don't get on. I don't find I just can't relate to you. It's perfectly fine. And I'm very happy to hand over to somebody, to one of my colleagues who's either younger, whatever, more skilled in an area, or just happens to be different in style to the way I do things. And there's no personal insult for me whatsoever. I'm old enough and long enough to the tooth that other than, I may be the right person for you on Monday. I could be the wrong person for you on Tuesday. And that's no problem. Now, consider complementary or alternative medicine. Again, I say this to you with the most wholesome attitude. If you find going for a Thai massage helps you to relax, then I think you should do it. If you find going for a walk helps you to relax, if you find doing therapy, meditation, anything that makes you feel better, then I think that it's a good thing for you. But remember, what you have is a defined neurological condition. Nothing is going to rewire the white matter in your brain, at least not at the moment. We don't have medicines or technologies for that. But if you're talking about doing this makes me psychologically or mentally feel better or emotionally, then I think that's a good idea. These are things. So embrace anything within reason that's sensible. And again, I would urge people to go to your organization's websites. You'll find, or on the boards where you have people with MS who say, look, I've tried this. It was very helpful for me. You try it, and if it doesn't work, stop doing it. If it does, you can come back and say, yes, I've tried this too. This is also helpful. Remember, there are people out there that do prey on people with conditions. They offer things that aren't true. But if you look at most reasonable practitioners who offer complementary services, and if you find them helpful, by all means, go for it. I suppose just acknowledging the fact that, look, it is okay to be angry about this, to grieve, bargain, be depressed, whatever it is you need to do to go through this stage of, I don't want this. I never asked for it. Please take it off me. But when you're finished all that and it's still there, there's the next step up the stairs. Talk about how you are with people who are close to you. Tell them you're afraid. Tell them you're not sure what's going to happen. Tell whatever. And it's true. I mean, but talking to people about how you are, whether it's the physical manifestation of the condition or, which is often really tricky, the cognitive symptoms. Because I could tell you right now, I could say to you, I have a cognitive problem associated with my condition. And you could say, geez, Mark, I don't see it. Where is it? And most, if I do have cognitive problems, they're invisible. For the most part, people don't see them. And it's much, much more easier if I walk down the corridor of Beaumont Hospital with a crutch and a cast on my leg. You could say, oh, look at that guy, I'll get out of his way to give him a straight run. On the other hand, if I walk down the corridor with dementia, you have no idea what's wrong with me. Or if I walk down the corridor with type 2 diabetes, or if I walk down the corridor with any condition other than an overt physical manifestation, it's very difficult to see what it is. I worked with acquired brain injury patients. Again, it's their biggest problem. People don't understand what's happening for me, the things that happen in my head. So if MS is affecting your cognition or how you interact with people, whether it's your memory, whatever aspect, it's important to let people know so that they're aware of it. Now, I mentioned I work with people with various conditions, and sometimes people say, I'm not telling people. If I tell them, they'll just start treating me different. And again, you're right. This is two sides of a coin. On the one hand, if I tell you what's wrong with me, maybe you will treat me differently. But if I don't tell you, you won't treat me differently and you'll expect the same from me. But I can't do that anymore. So there's two sides to all arguments. So remember what you're choosing, but it is your choice. Seek support. Again, it's often easy to say, much, much more difficult to do. What I would say is certainly, use your organization. You have this organization here today that brings you together. I know at least every year, but I know there's other services available. And I certainly know that they have a program. I'm going to talk about the one later on, kind of how to maximize your health, kind of a better health, better living program. Again, it's a way of bringing people together of similar conditions, similar like minds to work through issues associated with your condition. But they also may have other forums for you to get together. Now, again, I know people who would say to me, I don't want to be listening to people moaning about their symptoms. Okay, so maybe that group's not for you, but you can find a way to find support. Sorry, I don't mean to suggest that people would use this to do that, but oftentimes it is put forward as an argument for people not to engage in this, okay? Get educated. Again, one of the things I always say to my patients, look, when you go to your doctor, you're going to your doctor to educate him or her about what's happening to you. I like to go to my doctor and basically tell him what's wrong with me. I know that sounds a little bit, because surely the doctor's supposed to tell me what's wrong with me. No, the doctor can never do that. I have to be able to tell the doctor what's wrong with me. He then puts a diagnostic category around that and says, Mark, you have a diagnosis of, but you have to be expert in your condition. If you're not able to do that, or you need support, then have somebody go with you that's able to articulate that for you. But really taking ownership of your condition and taking ownership of your symptoms is probably, for me, the most important thing you can do. And getting educated about your condition, getting educated about what you can do is really important. I'm watching my time. I'm going to move a little bit faster. Get professional help. In your condition, there are a lot, and I'm just highlighting one here. And this is a very common feature of most neurological conditions. And I would argue this. Here's a simple example. I don't know whether any of you knows anybody who's had a stroke or not. I used to work in a stroke rehabilitation unit. So we would have lots of people, men and women, coming into the unit for rehabilitation. As soon as they walked in the door, they were commenced immediately on antidepressant therapy, as in antidepressant medication. They were given them orally. They weren't asked. They weren't said whether they were depressed. They were given as a matter of course, because the logic was this person has had destruction to an area of their brain. Chances are there's nasty chemicals going around. We need this person to maximize their recovery. So therefore, anything that will help the recovery is a good thing. So giving antidepressant therapy, along with counseling, setting goals, was the most prudent thing to do. And it increased exponentially when you looked at cohort studies. So again, if depression is there, it reduces your ability to cope. It reduces your energy levels. It takes away. Getting professional help for any aspect of the condition that's heavy is a good thing to do. So you're going to be sick of these, and people are going to say them to you over and over again. But I like to work on the things that I call are, when you go into the orchard, that you don't really have to lift your arm up too high to get the apples. Okay, so these are kind of apples that lie on the ground or kind of hit you in the nose as you walk up to the tree. Now, for people with MS, the idea of taking regular exercise may be, some of them are, you've no idea what I go through. But again, weight loss, sleeping better, nutrition, positive attitude, a diet plan. Why are those things so self-evident? Well, with a condition that may affect your physical functioning, if you're overweight, you've got larger mass to carry. If you're unsteady, it makes you more difficult to walk. If you take regular exercise, you're maximizing what you can do. These are so intuitively right. They're so common. It's just common sense isn't that common. You'll find that as you go through life. Sleeping, making sure you maximize your sleep, regular sleeping pattern. Go to sleep at the same time every night. If you're not sleeping, talk about it with your doctor. Nutrition, positive attitude. Again, if you can, I'm going to talk a little bit about that. Diet plan, maximizing your health through a proper diet. I robbed this slide. This is from the Better Health, Better Living program. And I think if nothing else, just keep looking at this slide. Now, this is called the vicious cycle. Okay, and it's almost like the chicken and the egg chasing themselves around in a circle. So on the top at 12 o'clock, you have what's called the disease features. And it doesn't matter. You can put in MS, diabetes, osteoarthritis, epilepsy, any condition fits in there. And associated with that condition are the features of the condition. That's what happens to you by having this condition. The next one we have are the physical effects of the condition. Tension, pain, fatigue, whatever the effects are. Then we have how I feel about that. Well, I feel shit that I can't do this anymore. I feel terrible. They're the emotional impact. I have the cognitive impact. Well, it affects my memory, my concentration, my fatigue, whatever. The lifestyle changes. I'm not driving anymore. I'm not socializing anymore. It affects my job, my work. Increased stress, poor compliance with my treatment, avoidance of things that would make, and it increases the disease, which increases the physical effects, which increases the emotional impact, which increases the cognitive impact. And this is called the vicious cycle. Now, if we take any one of them, any one, and you say, okay, let me look at the physical effects. How does it affect me? Tension, pain. Okay, what can I do about that? What could I do to change that? Lifestyle changes. I'm not driving. I'm not socializing. My job is to. What could I do about it? If you change any one of them, you change that whole cycle. Now, the one at 12 o'clock you can't change. That's the condition. But everything after that is up for grabs. And once you change that, you change the impact of each one that comes after it. I'm sending you these slides. You don't need to write these down. Okay, self-care, some basics. Self-care is not self-indulgence. It's self-preservation, okay? So self-care, I'm more likely to look after somebody else when I'm feeling good myself. So the better I take care of myself, the more likely I have to give to someone else. Seek information, stress management, mindfulness, relaxation, abdominal breathing, progressive, healthy diet, alcohol. Now, I have to say to you, I'm speaking from a low base here because I am somebody who enjoys a drink. I'm currently on dry November. Don't know why, but I'm probably getting ready for a wet December. But I like to do this in November. And it was very hard last night. I was watching CNN and watching the election, and I wanted to go and get a beer. Now, I am not going to have 20 beers. I just had maybe one or two, and I normally have one on a Friday night, but I didn't have one last night, and I don't really feel any much better today. You know, I can't say to you that I feel remarkably better, but I would have liked one last night, and I didn't have one. So it's a little bit of exercise and restraint. But for people with neurological conditions, alcohol has a further depressing effect. It affects your sleep, and it affects the quality of your sleep. So again, minimize the use of alcohol, exercise, sleep hygiene, resources, self-management. And I know there's self-management in MS. It's available for you. You can do this. It's about playing an active rather than a passive role in the management of your condition. This is the I talked to you about when you go to your doctor. You are an active participant. How many times do I meet patients coming into the doctor going, how are you? Grand. And no. Okay, take care. See you in 6 months. Not good enough. This is your opportunity. You go in, you demand the time. You do not get rushed out in 5 minutes. You sit there with your piece of paper and say, I have some things I need to speak to you about. We're going to do them. Be assertive about your condition. I'm not plugging this, but I'm really making you aware of this. This is called the Beaumont Mark site. It has nothing to do with me. It's MARC, Mindful and Relaxation Center. It's available free. You just type into Beaumont Hospital, the .mark, and it brings you in. And here are things for free. One of the things I would say to you is I listened to the first one and it's a woman's voice and I didn't really like her voice. Then I listened to another one, it's a man's voice, I like it, or vice versa. So there's young male, female voices, older male, female. So they've kind of said, look around until you find something that you find helpful. Say, for example, you have trouble falling asleep. Find something that you find that relaxes, have it on your phone, put your AirPods in, listen to it, and help you fall asleep. This is just some of the examples of what's available for you there. They're all free, by the way. Now, it is 12:14, and I'm going to stop there and maybe see if anybody has any questions or any comments about what we've talked about so far. And I have other things that I can talk about, but I did want to maybe talk a little bit about fatigue. And it is probably one symptom that warrants talking about. And I'm just going to go through this. I'm just going to go through. Okay, no, that's it. I'm going to stop there. So I'm going to go back over to you, Aoife, if you've anything or any questions there.
Rachel, thank you so much. Thank you. It was a wonderful presentation. And, you know, a diagnosis of MS, people process it very differently. But I think that the information that you've given there would be very useful to lots of people. And, you know, everybody can take what they need from it, I suppose, and everybody will need something different from it. So we do have a few questions in. Again, some of them were sent in prior to today's session, and then we have some on the Q&A. So I might go to that one first. So one of the questions is, while my diagnosis has explained a lot of what's going on for me, I have huge difficulty in dealing with the idea of all these lesions in my brain. Lack of control, I think, is my issue. Any tips to deal with these feelings? Thank you.
Okay. So we have this idea of control, and I suppose I would spend a lot of time with patients. And again, this is irrespective of MS. So forget about MS for a minute. Let me ask you a question. What do you control in your life? I won't need to write very much. There's very little about our lives that we control. We have the illusion of control. But what we can do, and it's a little bit like the old adage of, you can create the conditions where you give the best chance for good things to happen. So likewise, in the management of your condition, whether it's MS or any other condition, you can say, right, if I do these things, I provide myself with, and here's a great word, I love it, optimal. In other words, the best opportunity. I can't guarantee it. Bad things can happen. There's no guarantees. I was thinking about this morning. Bad things happen to good people. I was speaking to a gentleman, a young student who I had to who came across very recently, and he mentioned he went to a school that my son went to, and he said that did I hear that one of the teachers had a heart attack? And I said, no. And I was expecting maybe the principal because he was an older guy. And he said, no, it was the PE teacher. What's the chance? This guy runs marathons. Okay. Now, if you'd asked me to rank order the people in the school who's going to have a heart attack, this guy is like a lat. I mean, he is so thin. But he's the guy that had a heart attack. So you can't control everything, but what you can do is create the conditions where you live your life the best that you can. You get good sleep, good diet, sensible lifestyle. Again, I'm not asking you to be a monk. You don't need to be a closeted nun or anything like that. You can live an ordinary life, but you say, look, there are certain things that I'm going to do that are predictable and safe and allow me the best chance. I will take my medications. I will make sure that I get exercise. Now, once you've done that, you have created the best conditions you can to minimize the effects of your condition and to minimize the exacerbations that may happen as a result of the condition. That's not to say that you won't have an exacerbation, but you can go to your doctor and say, look, I've been doing everything you told me to do. And sometimes the disease just kicks off for no other reason. Maybe you got a cold or a flu and you had a temperature and it spiked off. But you're doing everything you can. But for the most parts, the idea of controlling this condition is kind of illusionary. So it's almost like I need to work on this to push that aside. I'll stop there.
Great. Thank you. Another question that was sent in advance of this was that any advice for disclosing the diagnosis to someone I'm dating? This is a new relationship and I'm not sure how or when is best to bring it up.
Okay, that's a good one. Okay, so I would imagine then that from that point of view, there is very little visible in you that somebody would say, I can see something is wrong. What is wrong with you? Why are you like this? Or why are you walking like this or something? So therefore the condition is that you're very new and fresh. And, it's a little bit like when you get into a relationship, I kind of think, think of the onion, the first time I meet you, I kind of show you my outer layer. And when I meet you the second time, I take a little bit off and I show you the next layer. I don't tell you my dad is in jail on the first date. I wouldn't do that. But maybe as we go along, I can say to you, when you haven't met my dad, well, actually, he's in jail, whatever. So, I mean, there's times when we give pieces of ourselves. Is there a correct time? I think I would say to you that you'll know when you're there. And that if this person is interested in you and wants to be with you, this condition is just another part of you. It doesn't define you. No more than having red hair or black hair or white skin or black skin defines you. It's just a feature of you. So this condition happens to be a pertinent feature of you. And certainly knowing this about you is going to be something that the person is going to have to process and decide, okay, what does this mean for me? Is this something I have personal experience of a colleague of mine whose partner was diagnosed with the condition. They just said, well, sure, look, I mean, it is what it is. Nothing we can do. I love the person and that's it. So they were a very young couple. I think she was about 28. So if the person is for you and meant to be with you, then you having this is not going to matter. And if it does, then maybe you're not supposed to be together. But I would say the timing of something like this is only something you can know.
Okay, thank you. And we have a question from somebody asking what they can do to help with their cognitive symptoms.
Okay. So the first thing I would say to you is knowing that you have them is a good thing. Okay. That's the first thing. Okay. And then I would say to you, okay, how manifest are they? How are they affecting you on a day-to-day basis? Have you gone and spoken to somebody? Have you gone to your neurologist and said, look, I'm having this. This is happening to me. I've noticed it. Has your neurologist sent you maybe to a psychologist or a neuropsychologist for an assessment to see exactly what the problem is? Where is it impacting? And if you had or did, has the psychologist said, okay, look, these are some of the things we can do to make this better. See, here's some of the ideas. And again, I would say to you, you know, in the same ways that if you were noticing something physical, you'd go to your doctor for kind of an assessment to see what's actually happened. I think in this situation, if you have a cognitive difficulty, I think going to a psychologist to get them assessed is a good idea because it lets you know exactly what you're dealing with and what are the best things to do to maybe handle that.
Okay, we have a couple of questions in here in relation to families about either finding it hard to talk to the families, a misunderstanding in the family of what MS is and how it can affect people, and then fear of how family and friends will, that they would look at you differently. What would your advice be to people who are experiencing difficulties with either families' acceptance, understanding, or how they are with acceptance?
Okay. Okay. So the one thing I would say to you is, you know, I happen to know somebody with osteoarthritis. You tell me you have osteoarthritis, and I say, "Oh my God, I know Joe. Joe has that. Yeah, it affects his arms." You go, "No, no, it doesn't affect my arms. It doesn't affect me." Like people have an understanding of a condition either by what they've seen on EastEnders. Well, and I don't mean that in a bad way, but how the television portrays the condition, or they know somebody with the condition. And when I know somebody with the condition, that's how the condition is. But in actual fact, people with the condition know that it's actually very varied. For those of you who've gone into a clinic room where your neurologist is meeting all the people with MS, you can see a huge variety of people there, and you're looking at who among these people have MS? And then you can see other people who are very affected physically, and you go, okay, that person. But we know that there's huge variability in the condition that's often lost on people who only have a passing acquaintance with the condition. It maybe just give them information. Maybe if they're interested and they want to know, you can give them websites to have a look. But if they are going to be useful to you, you need to spend the time with them and explain it to them. There will be confusion, there will be misunderstandings about what the condition is and how it's affecting you. But again, I would say to you, look, you're not going to do all of this in one sit down over coffee. It's almost like you have to start a process with somebody, educating them about how it is.
Okay, and then we have a few questions in as well in relation to kind of anxieties around infusions, blood work, relapses, just anxieties about what might happen, I suppose, and having those kind of medical interactions that maybe people wouldn't have been used to having up to this point. So with a new diagnosis comes lots of new experiences that people can often have anxieties about. Would you have any advice in relation to
Okay.
that?
Certainly. Let me give you an example. I spoke to a young lady the other day who this actually yesterday was 1 year seizure free. And that is huge significance for her because once she gets to 1 year, she can apply for a driver's license. She's 19. And as the last week of her approaching her seizure freedom came, she noticed her anxiety started to rise. She started to worry that she was going to have one. And then she started to worry that she was going to bring one on because she was so worried about having one. Okay. So I think recognizing that anxiety and worry about your condition, worry about events, going for a scan, going for an infusion is an anxious time. Recognize that. There's nothing wrong with that. You know, are you supposed to go in and say, this doesn't bother me? You recognize that it has an effect on you. You say, okay, well, if that's the case, what do I do about this? How do I cope with this? What's my best way to deal with this? But, you know, to simply say, I shouldn't feel this way is not usually a good way to deal with this. So acknowledging the fact that, look, I don't like this, I don't like anything about it, but I also have to find a way, because this is going to be part of me and part of my condition as I go forward. Concern about relapses, I think, all you can do is the best you can do. So you do everything you can to create the conditions that maximizes the chances that you won't have an inflammation or an exacerbation. But bad things happen, even to good people. You know this because it's happened to you already. You can't then say, oh, if I hadn't had that second piece of cake, probably look, you start looking for, what did I do that made this happen? Sometimes you did nothing. Sometimes these things just happen in the same way. You didn't do anything to get MS. You didn't do anything to get any condition. Something about who we are, what we are, caused this to happen. And now it's here. So using your resources, looking at it in a more kind of pragmatic way and say, okay, look, this is part of me. This is going to be part of how I am for the next while. Look at kidney dialysis patients. 3 times a week, they're going to get up to, I don't think they want it, but it's part of who they are now. And that's almost like, I have to get my head around this. This is something I need. Maybe I need help to do that. Should I talk to somebody about this? Can I speak to the nurse who's there and say, listen, I really have a problem with this. Is there somebody on the team I can talk to get me help for this? It's perfectly fine.
Just in the interest of time, I'm just thinking that we only really have time for we might just ask a couple of questions though, if that's
Sure.
okay with you, Mark, if you're happy to
Go.
do that. So one of the questions that came in was in relation to being diagnosed during a pandemic. And it's been particularly tough as this person can't do the things that they would normally do for self-care and in their spare time, and that they're feeling very isolated with their diagnosis at the minute. And they feel that it's adding to the challenge of accepting their diagnosis. And I'm
Okay.
wondering if you would have any advice.
Okay. I would have to say to you that, like the rest of us, our lives have been transformed over the last year. The fact that we're actually doing this today, because I think 2 years ago, I was in a hotel somewhere in the north of Dublin, talking to a group of people at the MS Society's yearly gathering, and everybody was there. You could see and chat to each other and have a cup of coffee and just shoot the breeze. And here today, we're doing this. I'm doing mine in my attic at the moment, but I mean, and I can't go out to a shop today. So we know our lives have changed, and it's impacted on how we live our life. There is an effect on our socialization. I can't remember the last time I was out for something to eat with friends or family, getting people over. We just can't do that anymore. But there is a sense, I have to say, look, this has impacted on me. I feel a lot more lonely, and I have to find another way to deal with this because I can't go and talk to people. So what are the things I can do? And this comes back to the idea of being adaptive. What are the things I can do to improve this? So again, getting out either virtually like this, contacting people, because at the moment that's all we can do, barring breaking the restrictions that are down for our own safety. But you're right, I notice in our hospital, I walk down the corridor on Monday or Friday and there's hardly anybody there. I know usually in Beaumont Hospital, it's like Grand Central Station. So I know people are not coming to hospitals. They're not attending appointments because they're virtually attending appointments. They're not even having the opportunity to go see their consultant in person. It is a huge change. I would hope in the fullness of time, maybe in the next 3 to 6 months, we should be back to normal, as in ordinary life should come back. But it has been very difficult. Merely just saying that, allowing yourself to recognize that, look, I'm dealing with a lousy illness and I'm dealing with it in a lousy time. I need to give myself a break. Just relax. I'm doing okay. I'm managing okay. I'm doing the best I can. That's perfectly fine. Okay. But again, reaching out to people, whether it's the MS Society, whether it's the MS nurse in your hospital, in your service, saying, listen, is there somebody I can talk to? I'm kind of feeling a bit alone. I think I need to speak to somebody. Getting out and making that step.
Great, thank you. And a few people have just asked if you might explain what some of the MS triggers are. If you might just give them a little a brief answer on that, would be great.
Right. So now let me answer your question this way, because it's something that I would have. I work with a lot of people who have epilepsy, and I would say to them, what normally causes a seizure? And they say, well, I don't know. I look all the time and I try and find out what I did maybe an hour or two beforehand to see what caused it to happen. I know I had fish for dinner on Wednesday and I went out running on Wednesday morning, and I probably didn't sleep great on Monday, but I did sleep well on Tuesday. And when you look at the pattern of things that are ingredients, there isn't a pattern. And when you actually talk to them, there aren't things that cause other than situations or events. So the condition itself is a neurological condition. We talk about a threshold. So in other words, let's say at the moment, the condition that you have is quiet. It's calm. Okay. Now, what are the things that make this process active? Well, normally, let's say, for example, you feel unwell physically. Let's say you catch something, you're not feeling well. That condition affects, normally we talk about we've got a headache, we've a high fever, we don't feel well, and affects our overall functioning. Because it affects our whole body, it can trigger an exacerbation. That's just a simple example. But it doesn't necessarily, because most of you say, well, I've had that and it never caused me anything. Each person is different. And if we had triggers, I could tell you to stop doing them. But unfortunately, each person is different. And we don't know why this gets turned on and off. But what we do know, if it does get turned on, that you get to medical help immediately. And you get attention, you get your infusions, you get your store, anything that gets the thing calm again. But if you go back and say, right, what are the things I know I can do that maximizes my chance for evenness, is regular lifestyle. Regular, even lifestyle. So it's almost like, do I treat the condition when it comes, or do I treat the conditions that may have this? And the conditions are, I'm regular in what I do. I get good sleep. I watch my diet. I get exercise. I don't do anything crazy. I live a good life, or as best as I can. I work in moderation. I socialize in moderation. I do everything I can. Now, I think if you have those conditions there, you're doing everything you can do and your doctor or neurologist is asking you to do to keep your condition quiet.
Great, thank you. Well, I think that about brings us up to time. Thank you so much for joining us, Mark.
You're very welcome.
We really appreciated it. A fantastic presentation. Thank you for taking the time to answer so many of the questions that came in. Thank you so much, everybody, for joining us this morning. Thank you again, Mark, for giving us your time. Much appreciated. Thank you, everybody.
Take care. Bye-bye, guys.
Bye.
Bye-bye.